Hello, welcome back to Prostate Focus. My name's Ian, I'm the curator of this channel. You might remember that in my first video, the introduction to the channel, I explained the boundaries and what we were trying to achieve. And I would encourage you that if you get an opportunity, look at that video before you move on to the next, which start to deal with medical stuff. If you have looked at that video first, you'll remember that my initial concern was that I was urinating too much through the night, some 6 times a night, and that a friend of mine had talked about going to his doctor with 3 times a night and had ended up with a cancer diagnosis. I booked my appointment with my general practitioner in July 2016. In the UK, the process is first to go to one's general practitioner, and then that general doctor refers one to a specialist in the particular area that one is concerned about. That's the process that everybody goes through. It's not usual to go to a specialist doctor straight away on my own. When I arrived at the doctor's, obviously I was in the waiting room. He came out, he called me, greeted me as they do. He had a second young person with him who he explained was a medical student, and asked if I would be happy if the medical student sat in on the consultation. This is something that's quite common in England. 3rd year, 4th year, 5th year medical students quite often sit in on practice in order to gain experience of what's going on. It's happened to me 2 or 3 times before, and I'm quite happy to have it happen. It helps develop new doctors. We got into the examination room, or his office. I explained to him the problem, and the first thing that he said was, well, obviously we should be concerned that at my age, I'm 64, at my age we should be concerned that I had an enlarged prostate, or perhaps even something wrong with my prostate. And he explained that the examination involved something called a digital rectal examination. Now, I guess some of you are already there. Sometimes this is called a DRE. It effectively means that the doctor places one of his fingers inside your rectum, through your anus, and it's possible to feel around the prostate, or the majority of it, to see if there's any lumps, any rough feeling and that kind of thing. I knew this anyway, but they explained it. I was asked to remove my lower clothes, to lie on the examination couch facing away from the doctors, and to draw my knees up to my chest as far as I could, thus exposing the bits that they needed to get to. I was asked if the student would be allowed to go first. Clearly that's right, he's got to learn to do it somehow. The student placed latex gloves on and quite a large amount of lubrication gel in order that he would firstly be able to feel easily, but also not hurt me. He started the examination. I felt no pain. There was no pain at all in this examination. The gel was cold and the pressure inside was odd, but not in any way painful. It was just a different experience for me. The student clearly had quite a good feel of my prostate. They stopped. The student and the doctor talked about it. He said he'd found nothing abnormal in any way with my prostate. The doctor said, yes, that's probably the case, but you weren't robust enough. Let me show you. He then donned latex gloves, put lubrication on his finger, and he had a go to feel as well. Now, he was much more robust. The pressure internally was more so. There was no pain. I felt absolutely nothing, but the pressure and the pushing sideways and things was, to say the least, was an odd feeling. At the end of both of those examinations, neither the student or the doctor could find anything wrong with my prostate from that type of examination. From this, they diagnosed something called benign prostatic hyperplasia. That is often abbreviated to BPH, benign prostatic hyperplasia. Basically what it means is that in people of my age and older, your prostate can swell, can grow, and it places pressure on the neck of your bladder. This in turn prevents your bladder fully emptying because it closes up the neck a little bit, and Theirs is a constant feeling of needing to urinate. I should explain that a bladder sits sort of, if you can imagine a balloon with the blowing up bit down here. The prostate sits around the neck of that balloon, all the way around. And if it swells up, you can see quite clearly that it will tighten on the neck and prevent it fully emptying. That was the diagnosis at that time. I was prescribed a course of a drug called tamsulosin. If your country or your culture deals only in branded products, it's quite often called Flomax. It's a product which is intended to relax these muscles at the bottom of the bladder down here and promote the emptying, the complete emptying of the bladder. To be on the safe side, the doctors decided that they would also take something called a PSA test. The full name of that is a prostate specific antigen, and it looks for little markers in your blood that are secreted into your blood from the prostate gland as a result of having some sort of growth on the prostate. In England, anyway, the normal range for somebody of my age is anywhere between 0 and 3. So the blood test looks at the PSA level. If it's up to 3, it's considered not a problem. If it's over that, then it's worthy of further investigation. When my blood test results came back, it was the 8th of August 2016, I received a letter from my general practitioner telling me that my PSA level was 5.8. Now that's kind of almost twice of what it should be at the highest level. And so he took the liberty, as he said, of referring me to a consultant urologist. This is a specialist that deals with bladder problems, with prostate problems, with erectile problems, and with all those problems of men, basically. In the area in which I live, we are very, very fortunate in that our team is really quite eminent. How did I feel at this point? Well, my PSA level was twice what it should be, but it was still relatively low. I have friends who are walking around with PSA levels of 12, 13, 14 without any problem whatsoever. But it did mean that it warranted monitoring. I didn't feel panicky, I didn't feel concerned that I had cancer. It was just a PSA test. And whilst PSA tests are quite a good indicator of something that needs investigating, they're not always 100% reliable. They can be high for other reasons. And so I was feeling quite relaxed about the whole thing. In my next visit, I will describe the appointment with the urologist. I will describe the things that the urologist found and the further diagnosis tests that he recommended. I will describe the fact that I was recruited onto a clinical trial. That will be the third video in this series. And as we sign off, I think I sign off once again with a note that if you know anyone in your family, in your friends, from your work colleagues, who you think needs advice about a prostate problem, please encourage them to visit a medical professional. These things do not go away of their own, and they are easily treated if caught early. Thank you. I'll see you in the next video. Goodbye.